Okay, so we've got our ventilator 100% ready. We are now ready to put it onto our patient. So our patient's been intubated, someone's in the room bagging them, we wheel in, get it all set up, and then we're going to go ahead and take our ventilator out of standby. We do that by pushing the power button down at the bottom. You see it starts up, take our cap off, and then we're gonna go ahead and attach to the patient. So, remember we had two settings that we didn't adjust when we initially set our ventilator up. The trigger and our inspiratory rise. So if we go down to this bottom additional settings button, it instantly opens and we can adjust our trigger there. So we want our trigger as sensitive as possible without auto triggering. So if we click on it, we're in a flow trigger of 5 at the moment. So if we take it down to 3, see if that does it.
So notice the reason that Crystal is mentioning this, if you look on the right side, you can see the patient is getting a rate of 38, which is crazy, and the patient is not going to make an effort of 38 in adult first setup, or at least very seldom. So Crystal immediately, being the good RT she is, knew that this was auto-triggering. So we've got it set to sensitive, and so she reduced it from 5 to 3, makes it less sensitive, and now she's gone down to 1. So we're now 1 of a flow trigger, and notice our rate is still 38. So now she has put it down to -1, which is a pressure trigger, clicks accept, and boom. So she has done this perfectly. She went from a nice sensitive 5 of flow, which normally we start with flow if we can, and then has reduced it to make it as sensitive as possible without auto-triggering, which has left it at a trigger of -1. And it's doing perfect. Now notice the patient is not making any inspiratory efforts at all. So at this point, we will also leave that last setting, which was inspiratory rise, and you can see that set at 0.15 a second, so that determines how quickly we get to our peak flow, and the patient's making no effort, so we'll just leave it right at that spot. If they start making effort, we need to adjust. If they have real flow hunger, we may turn that down to 0 even, and if they seem to be feeling like they're getting blasted, we may even slow it down a little more to 0.2, 0.25. Usually won't go quite as high as 0.3, but if some patients, that may be necessary. And then of course, if we just hit accept, we do it, but there's actually no change needed because our patient is comfortable not initiating any breaths, just getting the 10 machine breaths set at this point. So our last thing now is to adjust our alarms. So now that our patient is connected, we can see in the bottom right corner that they're on a tidal volume of 500. Remember, based on compliance, we'll determine what their peak and plateau pressures are. So we can see our peak pressure is 16. So when we go to set alarms, we generally want to set our peak pressure 10 to 15 higher than our set pressure. So in this case, we would probably set that to 30. That would be 14 higher, and that would be a good place to set that alarm. Now our next alarms are our minute volume alarms, low and high, and our set mechanical ventilation, minute ventilation is 5 liters per minute. So you can see Crystal's pointing at it there, it's flashing red, because notice our alarm is set to 5 as well. So we want to set that generally 1 liter less than that, so we would set it to 4. And once we hit accept in the bottom right of that menu, that will accept and the alarm will disappear. Now, if you look at the high minute ventilation alarm, we'll probably want to set that rationally. Some people would say just 1 liter above as well, but that will give us an alarming state if they even trigger 2 breaths. So what I would suggest is at what point are you going to worry about your respiratory rate? And most people, that's about 25. 25 times 25 breaths times 500 mils, which is what we have set for our tidal volume, will give us 12.5 liters. So I would set that upper alarm there to 12.5 liters. Some people will set that lower. I'm just telling you the way I would set it. Then we would set our high respiratory rate on the next line to 25. That goes along with our high minute ventilation alarm. And our low respiratory rate, just set a couple less than set. Our set is 10, so we'll set that to 8. And then lastly, we have our PEEP alarms, and our PEEP is currently set to 0. So we want to set our low PEEP alarm to 0 as well. And then our high PEEP to 2 or 3. And then everything's ready, just hit accept. That is our setup. So we have one last thing that we want to do. If you look at D, under the settings, it says perform a vent check, and we want to do this so we can see changes when they occur. So Crystal is just going to show the first few items that you would include on your vent check.
So on your vent flow sheet, your ventilator is your Servo-I. You can click on your mode, you know it's your volume control. So you can just write in VC. Rate, we have a set rate of 10. Tidal volume, 500. Flow, or your I time. Stop. Am I doing set or actual? Because in real world, we do set and actual.
So, good question, Crystal. So, what would we actually do? So let's do both.
Okay. So, you're going to have your settings, and then you'll have your actual next to it. So, I time is 0.7. I to E, we're at 1 to 6.7.
And then we would continue on charting down the list. And when we are charting for patients in the real world setting, we will be including all of the alarms, all of the settings, including at least once a shift, if the patient's stable, our compliance and raw, and other things to do with airway position, etc. So that would be our step 1.